For patients who are asking to me which dental implant do I need, I can say that the best implant is the one which is being performed for an experienced doctor and being maintained by a healthy caring patient.
If you're thinking about all-on-4 implants, one thing you might wonder is, what does the treatment process actually look like? Let's learn everything from Dr. Atasoy. What's it like to get all-on-4 implants?
All-on-4 implants is a very efficient and evidence-based treatment. In old-school traditional approaches, we used to make bone grafting in xylosilic areas or posterior parts of our mandible. But when we divide jaws into 3 zones, first one is in the anterior, second one is the premolar, and third one is the molar. Most patients have bone in 1 and 2nd zones. So in such patients, we can use bone tissue to avoid further bone surgery, grafting surgeries, and increased morbidity can occur. So we place 4 implants for that kind of patients. Generally, we place 2 straight implants and 2 angulated implants. That gives us the chance for placing implants in the same session with tooth extraction. You can't use immediate loading. It means delivering the temporary fixed prosthesis just immediately after surgery. That gives us the chance for a patient to have more comfort. Mostly they ask for, because in the waiting period implant treatment, they ask, do I have adapters? So when we place temporaries, we follow our system. They don't be adapters. In 3 months waiting time is sufficient for that kind of treatment. Mostly in grafting surgeries, waiting period may be more than all-on-4, and they may need to come again, means extra cost for travel, trip, and etc. It's more practical way of most patients in our daily practice of person.
What are the benefits of having them?
We also use less materials, so it's more economic in terms of biomaterials. For example, for xylosilate, we use xylosilate grafts, membranes to increase bone volume. And later on, we place X-ray blunts because the materials are increased in old school treatments. Patients may pay for much more, but all-on-4 is cost effective and it saves time and money also.
How does the treatment process look like?
Generally, 4 to 5 days will be enough for our first if our patient sends us another X-ray. If everything is good with our patient's bone tissue, we can do the surgery, and day after the surgery or 2 days after the surgery, we place the temporary fixed prosthesis. 1 more day will be sufficient to see if everything is going right and our patient is compatible. We generally administer drugs according to that protocol and our patient comfort is high. I recommend patients to be relaxed and don't be anxious about the post-operative period. On the 5th day, my patient can go to her country, and 3 months later, they come for the 2nd stage for prosthesis. In general, prosthesis needs 2 weeks at least to have a very effective and lightweighting and durable prosthesis. It's called UD Smart. We use a strong material but 3 times lighter than other traditional prostheses. So it's a very technique sensitive material, and 2 weeks will be the best option. But if our patient has more limited time, we produce the prosthesis with other materials such as acrylic, can produce faster. In such cases, 1 week may be sufficient, but I don't recommend 1 week. I generally recommend for 2 weeks of time.
Can you get them in a single visit?
For permanent prosthesis, I don't recommend to place a permanent prosthesis over an all-on-4, because permanent materials are strong and hard materials like zirconia, like titanium, and like porcelain. And because they are strong and stiff materials, they directly conduct all forces to the bone which is trying to heal in the early phase of healing. It's very risky, highly risky for me, and despite I have a lot of experience on that field, I avoid to place permanent prostheses in the first visit. I place a temporary. After they heal, I recommend to place the permanents in the 2nd visit.
What is the success rate?
All-on-4 has over 98% of 10 years follow-up cases. In our daily routine practice, we see the same results because there are some key points in that treatment, such as oral hygiene, not to smoke, good regular follow-up. If patient meets that three criteria, there will not be any cause for being unsuccessful. We also have a high level of success in all-on-4 cases, but it has a two steps. One step is our patient, one step is our treatment. Both sides should be in cooperation. In that cases, our success will be over 98%.
Get a great smile with dentification. Visit a hand-picked dental clinic today.